Dr. Abhay, Dr. Smita Singh, and respected dignitaries, my beloved great students, and also in this meeting, I have my Guruji from IICB Calcutta, Dr. B. Achari. We will discuss the benefits of nutraceuticals and functional foods in boosting immune competence and reducing the severity of COVID-19. Now you can see some of the pictures, how COVID-19 is causing the problem. It goes to the throat and lung, and it is also indirectly affecting our brain. So COVID-19, it is a pandemic of the millennium. Now, stage one, COVID-19, this virus gain access to the body via inhalation by transfer of virus-carrying fluid, maybe from hand to eye, hand to mouth, or by nose contact. Now, it binds to the goblet cells and ciliated epithelial cells. Those are located in the nasal cavity and mucous membrane and interact with the viral spike protein and the ACE2 receptor. Subsequently, it starts replicating. Now, ACE2 is a proteolytic enzyme. Now, there is a sequence of process, and the initial condition of infection is generally asymptotic for the first 1 to 2 days. But in the second stage, the upper airway and the conducting airway response causes the problem. The virus replicates and creates the problem. And what it does, dismantles hemoglobin and induces an anaerobic hypoxic pathologies and chronic anemia syndrome. And virus migrates down to the respiratory tract through the airways, triggering a robust innate immune response. And now exacerbating the anaerobic or hypoxic condition. That means when we have shortage of oxygen, initiating the formation of thrombi and coagulopathies. These are the biomarkers of pathogenesis in the lungs and circulatory tissues. Now, let us see what happened next. Hypoxia, ground glass infiltrates, and progression of acute respiratory distress syndrome. Now, 20% patients progress to stage 3 and develop pulmonary infiltrates and severe disease. And the fatality rate is about 20%, but it varies with advancing age and existing comorbidities. Now, virus reaches the lung, infects, propagates like a self-replicating pulmonary toxin. Now, COVID-19 causes alveolar damage with fibrin-rich hyaline membranes and a few multinucleated giant cells. Now, recovery will require a vigorous innate and acquired immune response and epithelial degeneration. That's why you will see in nutraceutical and functional foods, we are always saying, boost your immunity. Now, here, in addition to zinc, take zinc supplement, probiotic, vitamin D, and selected phytopharmaceutical synthetic. What it will do? It will restore the aerobic metabolic events in conjunction with promoting a robust immune competence. Now, you can see what's happening. Initially, the pre-symptomatic phase. Then it goes to the viral genome, it reaches the peak. And then it started causing the mild, moderate illness. Then it leads to severe illness and critical illness. Now, older population, they get affected. The CVD and high blood pressure people, they get affected. Obesity is a major problem. Diabetes, another major problem. Cardiopulmonary diseases, cardio-obstructive pulmonary diseases, these are the problem, as well as malignancy and cancer. On the right, you can see the various biomarkers: CRP, IL-6, ACE2, ferritin, lactate dehydrogenase, neutrophilia, and D-dimer and DVT, deep vein thrombosis. Now, this is the old strain. There were symptoms like fever, loss of smell and taste, and persistent coughing. But new strain, it is causing several other strains, problems. Aches and pains, conjunctivitis, sore throat, then diarrhea, and headache, and rashes on the skin. We published a paper in Journal of Systems and Integrative Neuroscience. I have forwarded it to Dr. Abhay Kumar. Now, here, treatment, what are the treatment modalities? First of all, prevent the virus from binding to the receptor, and inhibit viral replication. There is a very nice paper came out, and it is one of the best papers came out in Nature Reviews. I have the reference right here, and you can see what's happening the stage-wise, how the viral particle that they attack our body, and you can see what are the consequences happening in our body. Now, Dr. Abhay Kumar and I, we edited a book, Antioxidant and Functional Foods for Neurodegenerative Disorders, Uses in Prevention and Therapy. That book came out from CRC Press, one of the largest publisher. Now, this book we dedicated to the founder of BHU, and we indicated that we dedicated to our respected guru, Pandit Madan Mohan Malviya. And here, what we mentioned in that book, keep yourself happy and good mood. And if you have good antioxidant status, and if you can maintain a good harmony and good food habit, then it will maintain a aerobic cellular respiration, homeostatic regulation of adaptive rehydration, refueling, and recovery from the structural damage and diverse infection from cellular injury, and at the same time boost your brain health. Now, maintain the best possible nutritional and metabolically balanced state to achieve the best possible immune competence and host defense. And healthy aerobic cellular metabolism effectively improves morphological, hematological, rheological properties of blood, and that will stop coagulation, will minimize under that condition, and it will ultimately boost immune competence and overall health. Most importantly, improve your brain health, because COVID-19 attacks the brain in one of the biggest way. Now, here we mentioned about the famous Krebs cycle. You can see here anaerobic metabolism and aerobic metabolism. What exactly is happening? Where we are using defensive expenditure of alkalizing buffer in hemoglobin. And what it causes? Dangerous lowering of blood pH. Now, hypoxia state, it induces anaerobic metabolism. When there is no oxygen, you need oxygen, but to a limit. So if you need requisite oxygen, then you can prevent anaerobic metabolism. And anaerobic metabolism, it needs 38 ATP molecule per glucose molecule through the glycolytic cascade, Krebs cycle, and the electron transport chain. So here you can see we mentioned that what is the beauty of aerobic metabolism over the anaerobic glycolysis, which yields only 2 ATP molecules. Which is 19-fold less or 19-fold more sugar you need to produce the same 38 ATP molecule as aerobic glycolysis to the third function. Now, innate immunity and adaptive immunity. Innate immunity refers to the non-specific defense, whereas we talk about adaptive immunity, antigen-specific immune response. Now, we edited a book, we mentioned about immunity and inflammation in health and disease. Came out from Elsevier. We also edited another book, Inflammation, Advancing Age and Nutrition. I did it with Dr. Irfan Rahman. And in those books, we mentioned about innate immunity, adaptive immunity. Adaptive immunity includes the memory that makes future responses against a specific antigen more efficiently. Now, we heard about the black fungus, the deadly fungal infection, which is also known as zygomycosis. Now, types of mucormycosis, what it does, cutaneous mucormycosis on the skin. Then it does it on the sinus and brain, rhinocerebral mucormycosis, pulmonary mucormycosis in the lung, and GI mucormycosis, and related mucormycosis. COVID-19 triggers mucormycosis by modulating cell-mediated immunity. It reduces immunity, especially in uncontrolled diabetics who has high HbA1c greater than 8. Now, immunocompromised subjects, they are more prone to mucormycosis. Diabetics and corticosteroids, and with increased risk of and mortality. Iron overload in COVID-19 patients, organ transplant patients. Now, immune boosting nutraceuticals in turn can modulate these metabolic abnormalities. Now, selected nutraceutical mitigate these inflammation and viral entry. One of these example is cinnamon, darchini. Now, vitamin D, it is a refresher. And vitamin D, what happens in case of deficiency? Inflammation will go up, immune dysfunction, predisposing severe infection, vulnerability of into infection with enveloped viruses, including retrovirus, herpes virus, hepatitis, dengue, and COVID-19. And it has been also done by an Italian doctor. He did an autopsy and he showed vitamin D deficient subjects are more prone to coronavirus. Now, global data correlates severe vitamin D deficiency with COVID-19 coagulopathy, reduced platelet count, prolonged prothrombin time, and disrupted immune response and increased mortality. Here you see, this is also in our published paper where we showed immunomodulation. It boosts up the immune health, and it is a good antioxidant. It causes antimicrobial and anti-inflammation effect. We published this paper in Journal of American College of Nutrition. I did it with the Manipal University, Department of Pharmacy, and probiotics and psychobiotics. Now, these can also boost your gastrointestinal health. At the same time, it can help boost your brain health. What are the problems? Dysbiosis, altered gut microflora. This predisposes abnormal inflammatory status and increased susceptibility to disease. Now, probiotics maintain symbiosis in the gastrointestinal tract and boost immune competence. And symbiotic state help to control the severity via the lung or the gut-brain axis. Now, here you see the picture, probiotics and psychobiotics. What is the difference? We published a paper in Archives of Medical Research with the same Manipal University School of Pharmacy group on the probiotics and prevention and treatment of COVID-19 current perspectives and future prospects. Here we show, can we use probiotics and vitamin D together? What are the ultimate thing? Anti-inflammation, antioxidant, and antimicrobial effect. At the same time, probiotics secreting lactic acid will reduce intestinal pH, thereby it boosts up the vitamin D absorption. Selected probiotics, the PDR expression will go up and its transcriptional activity will be elevated. Expression of cathelicidin and antimicrobial peptide, its expression will also increase. And increase the Paneth cells and expression of different cells. That will help you to protect against these outsiders, coronavirus. Now, here, India, it is a land of spices, and we are the land where we get all these nutraceutical and functional foods. But I am sorry to say that these nutraceutical and functional foods, these are being widely used in America, and it is being regarded as Dhandantari in America. One of them is cinnamon. And see, they are putting 1,000 milligrams cinnamon in their nutraceutical formulation. Ginger, other, which we use it, ginger root. We call it adrak. And here you can see ginger in the bottle. Then you talk about curcumin, the turmeric, haldi. That is referred as solid Indian gold. That is what I mentioned in my lecture. And this is black pepper. And this is one of the highest selling curcumin and black pepper combination, which is being sold as a capsule. Now, curcumin is not very bioavailable. That's why our grandma used to put it in milk, one milk before bedtime. It has wonderful effect, anti-cancer, anti-diabetic, anti-obesity, anti-arthritic, and whatnot. This, and also it boosts the brain power. Now, pine cone is another product we use Proligna. It is another wonderful product which stops the viral entry. Aloe vera. And aloe vera, it is available in northern India and other parts of the world. Then quercetin and bromelain, these two are another flavonoid, and bromelain comes out from pineapple stem mainly, and L-lysine. And L-lysine has been shown that it prevents the viral entry to a maximum extent. Next, we have vitamin C. And then we know, but to protect our brain, we have Jyotishmati. This is a 5,000-year-old Ayurvedic herb that had been used widely, but most of the Indians forgot it. But Americans, they are using it in quite a big amount. This is another one which is known as Shankapushpi, Convolvulus pluriclas. This is also a very good neuroprotectant. Then this is Brahmi. This Bacopa, this is being sold as nutraceuticals widely in America. Then we talk about rosemary plant, which is a wonderful source of a triterpenoid, ursoleic acid. This is the structure of ursoleic acid. And ursoleic acid is also sold as such. And you will be glad to know that in Chandigarh, chemical resources, they have come up with a product known as Palmostrong. They have more than 200 employees. They made a proprietary formulation with quercetin from Sapoda japonica, ursoleic acid from rosemary, and vitamin C. And these capsules were working very good for the coronavirus patients. And it has been demonstrated that these patients, these workers, they are protected, and currently it is being evaluated in PGI Chandigarh. Zinc supplement is another supplement which boosts the antioxidant and immune competence, membrane stabilizer, and it is activity of a host of zinc metalloenzymes. Skin and connective tissue metabolism and repair, wound healing, prostate health, ocular health, and synthesis of DNA, RNA, collagen, antioxidant enzymes, and help in protein duplication of cells and gene expression. We published a number of papers, and it boosts the sense of taste, night vision, and healthy epithelial tissue. We published a number of papers in the past. Now, we are going to talk about Prodophyte. That is one of the supplements where we are using Astragalus membranaceus, Polygonum, Camellia sinensis, Marticaria camomilla, Rosa canina, then Eleutherol root, hawthorn berry, gotukola, ginger root, elderberry, then aloe vera, and pine cone extract, vitamin B complex, A, C, D, and E, and a number of micronutrients. And it has been shown we used, this was a legendary invention by our group to boost our bioavailability. I will quickly show the video. I believe internet is not very good. Let's see. I think I have to.
Sir, network is very. Sir, network is very slow, so please avoid this video. Bakshi sir, can you hear me?
Yeah.
Sir, please stop the video because it's not shown over here. Network is very slow. Please avoid this video.
Okay. Network is not working. Okay. Okay. Now, pine cone extract, it has been shown that it is a water extracted freeze-dried powder rich in monosaccharide, polysaccharides, diverse bioactive phytochemicals, several phytochemicals. It boosts the endurance and boosts the immune system support, antioxidant, anti-inflammatory, and boosts the cellular immune response and strengthens the gut microflora. Rose hips is another nutraceutical. It has lots of bioflavonoids and it has several beneficial effects against the viral infection. Cottonberry is another nutraceutical with lot of ingredients inside it, and students can use these notes for their studies in future. Eleuthera root is another one which is full of acanthosides, phytosterols, terpenes, saponins, and the dihydrodecanol alcohol, monopyranose, and several other ingredients. It boosts the endurance, improves memory. Gotukola is another Indian herb and it has lot of beneficial effect in boosting cognition and anti-inflammatory efficacy. Aloe vera, this is another ingredient which boosts the stamina and endurance, increase the energy level, boost the immune system, attenuates wound healing and sports injury, and muscle soreness can be protected. Muscle and joint pain can be eased, improved joint health and anti-aging effect. Now, we published a paper of GMP 35 nutrition research in 2019, where we showed that representative baseline of the live cell. And this is what exactly is happening in coronavirus. It is getting agglomerated. But with time, when we are using water, then it is getting little bit better, but it is also agglomerated. But when using MP35, this clinical study showed that here the morphology has been improved significantly. Hematological characteristic of the subject was significantly improved and exhibit the strategic intervention in the restoration of hemoglobin in red blood cell and reverse the progression of anemic pathologies considered as iron deficiency anemia. And these are wonderful oxygen carriers. Now, nutraceutical and functional foods provide significant protection against diverse viral infections, boost immune competence and antioxidant defense, therapeutically restore hemoglobin in red blood cells and keep them healthy, and enhance the aerobic homeostasis and and reduce the anaerobic homeostasis and boost the antioxidant efficacy. We published this book this is about 700 pages book from CRC Press back in 2017. So let food be thy medicine and medicine be thy food. Now I thank you very much. I know that it is echoing. You cannot hear everything.